An I-9 investigation tonight. A group of former nurses at the state-run Independence Mental Health Institute say patients repeatedly assaulted them and the state ignored their cases.
The former nurses filed a claim against the state saying they have permanent injuries that could have been avoided and claim the institute's administrators and supervisors had a callous disregard for their well-being. Behind this tree-lined driveway lies the state-run Independence Mental Health Institute. It serves children, adolescents, and adults who require hospitalization for acute symptoms of mental illness.
Nothing compares to what happened to me on this day on August 18th of last year.
Angie Timmerman, Olivia Berger, and Laura Smith were all nurses at IMHI until they say they were attacked more than once, causing both physical and mental injuries. Timmerman says a juvenile patient punched her in the head.
And then she took my hair, and she ripped it out, and she threw me to the floor, and then she foot stomped my head and neck multiple times. And this was a 17-year-old girl that was about 5'10" and weighed almost 300 pounds. And ultimately, my injury was a spinal cord injury, and I had a disc that was embedded into my spinal cord, and they had to do a fusion.
And my first day there, I actually got punched by a boy.
Olivia Berger says weeks later, another patient was angry when that person faced punishment for an incident during lunch. She would later be attacked 4 more times in 4 weeks, including a sexual assault.
I suffered a concussion, a TBI. I have hearing loss to my left ear because the second time he punched me towards my ear. I had floaters in my eyes. I am still working through my PTSD and anxiety and depression.
And Laura Smith's story is especially heartbreaking.
I thought everything was okay.
It was June 15th when Laura and staff thought they had de-escalated a violent situation involving a 17-year-old boy. She says she was suddenly attacked from behind.
He literally just comes up and knees me in my stomach as hard as he can.
Smith was 4 months into a pregnancy. She and her husband conceived through in vitro fertilization.
Ultimately, we lost our son.
His name was Levi.
When the attack happened, I was not sent out to be seen. I was asked to stay at work because the staffing numbers were so low they couldn't afford to lose me.
These 3 women say the same thing. The population at Independence Mental Health Institute is getting more violent. There are few consequences for juveniles who attack staff. Administration doesn't respond to staff injuries, and there's no effective security in place in an environment that can, at times, be likened more to a prison than a mental health facility.
Usually when someone calls us about a work injury, it's a single incident that happens.
Attorney Darren Lenekis and Robert Ray Kemper have filed a claim against the state that claims gross negligence at IMHC that has resulted in repeated assaults by patients caused by systemic failures and non-existent or insufficient corrective action.
It's only going to get worse unless the state steps up, admits what it's doing wrong, starts getting some basic security measures in place.
They allege Independence is the place the state sends violent juvenile offenders who can't or won't be placed elsewhere.
They don't need to be like a maximum security prison, but if you're going to be sending people who are in prison who can't stand trial into a facility like MHI, it shouldn't be take the handcuffs off.
IMHI is a 56-bed facility, the larger of the 2 Iowa mental health facilities that are still open. It was cited in 2019 by Iowa OSHA, levying more than $72,000 in fines for 10 violations. 7 were deemed serious. But these nurses say the problems remain. 5 years later, they say the radios they use to call for help,
That's your lifeline. If there's an emergency, you need that radio.
Are often unreliable.
You have an emergency button. They would not work, or they would send people to the wrong floor and you would have nobody.
And when they were injured, these nurses say they were expected to stay on the job because there wasn't enough staffing. They'd file paperwork about their injuries, green slips, that were later said to be missing.
So the green slips are the employee injury slips that must be filled out anytime there's an employee injury, and there is no carbon copy to this, so you just fill out the paper and it gets lost, and then there's no accountability on the state's end.
Accountability is part of what these former nurses say they want.
You want to see roaches run, shine the light on it. Watch what happens real quick. Things get fixed very quickly when the rest of the public knows exactly how bad it is.
For Angie Timmerman, Olivia Berger, and Laura Smith, they want to make sure IMHI is safe for those who still work there now and those who will work there in the future.
Do you worry about their safety as well?
Always.
Because their lives will never be the same.
I am not the same mom. I'm not the same wife. I'm not the same coworker. And it's affected my whole life. I can't walk into a store without crying when I see pregnant women. I'm angry at them for no reason. And it's selfish, and I know that, and I feel bad. But I can't help but feel like that.
All three women have filed workers' compensation claims. All of their claims are still open at this time. And the State Department of Health and Human Services issued this statement to KCRG TV9 this afternoon. It says it cannot comment on pending litigation. The safety of the patients we serve and the employees at our facilities is our top priority. The statement continues, these facilities serve the most vulnerable clients when other options are not available or when a significant level of expertise is warranted.